All right. Right. So we proceed. A little bit about HEED in a nutshell. HEED is involving health education and integration of immigrants and refugees in Finland since 2018. And now HEED is involved in health is wealth. Health is wealth is public funded project. We provide information and raise awareness of health issues among immigrants and support immigrants making lifestyle changes towards a healthier life. We also train healthcare students and professionals in cultural sensitivity and cultural mediation. So this involves individual health guidance, open well-being days, peer support and physical activity groups, webinars, and health issues for immigrants. So HEED is actively involved in outreach and also in guidance. So this project is quite huge and so I think we are running. And not I will not dwell on that thus far, but that's exactly what he is about. It's about health and well-being and partly integration. So before I call in our first speaker, I hope the questionnaires or has been answered and the participants are back actively involved to listen to participants are with us right now and are ready to take in Dr. Mammadova Inara. So, doctor, if you're ready, please, you can come on.
Thank you. Thank you. Yes, I am ready. One moment. Let me start sharing. We just practice it. I can do it. Slideshow. And yes, I hope you can see it. Would Aino or someone tell me if you can see?
Yes, we can see.
Yes, it's perfect.
Great. Thank you. So yes, thank you very much for having me to talk about a very important disease. It's a disease to be taken very seriously. One moment. A little bit about me. I am Dr. Inara Mammadova. I was born and raised in Azerbaijan. I studied medical degree in Istanbul, Turkey, and I studied as a registered nurse in Espoo, Finland. And right now I am specializing to be a general practitioner. In some countries it is called family doctor. In Finnish it is yleislääkäri. And my current employer right now is HUS, Helsinki University Hospital, Department of Plastic Surgery. I am interested also in wound healing, so I hope I will get there a lot of know-how. Most of my references in today's presentation are from Finnish care guidelines, that is käypähoitosuositukset, and American National Library of Medicine. Unfortunately, I have a habit of talking too quickly, so if I do that, please stop me and ask me to talk a little bit slower. Why doesn't it change? Why I cannot change the slide? Maybe with the structure of presentation will be more or less like this, and emphasis today will be on type 2 diabetes and diabetes of pregnant women, because they are very important for public health. What is diabetes? In very short, it is a disease where blood sugar level is elevated for a prolonged time, not once, but for a prolonged period of time. And for that, we need to measure sugar to diagnose the diabetes. We measure sugar either with a quick meter. I hope you see my mouse here on the left side, or in a lab. And the blood sugar levels are here, normal blood sugar levels when fasting. According to American Diabetes Association, it should be either 5.4 or less, and World Health Organization recommends 6 or less. Finnish guidelines go with the number 6. And then we measure also what is the blood sugar level 2 hours after eating. And then also we measure your average blood sugar over the last 2 to 3 months with this HB1AC. On the lower row, we see diabetic levels, and these are what we look for to diagnose the diabetes. But to diagnose the diabetes, it is not enough that once these numbers are not right, it should be at least twice. And then we will diagnose that a person has diabetes. Diabetes is not a new disease. The disease has been known to science for centuries. First mention known to us is found in a manuscript made in 1500 years BCE in Egypt. And the Latin name diabetes mellitus means excessive discharge of urine that smells sweet, which is one of the main symptoms of the disease. And how is glucose, that is sugar, processed in the body? It is a very complex process. So we will focus today on the, how can I take this away? I hope you are not seeing that row. We will focus today on the part that is important for the diabetes. When we eat, and our blood sugar level raises in the bloodstream, it makes pancreas to produce hormone called insulin. Insulin has many functions, and the most important one is to knock on the doors of the cells and ask them to take sugar in. Cells will later use this sugar as the energy to make whatever they're making. For example, in the case of muscles, muscles will produce energy for us to move. 1 moment. Yes. Types of diabetes. Type 1, it's insulin deficiency, meaning there is not enough insulin produced by the pancreas. Type 2, there is insulin, but the cells do not answer when insulin is knocking on their door. Gestational diabetes, it is diabetes during pregnancy. And there are some other diabeteses that we will not be talking about today. They're a little bit more rare. What causes diabetes? Obesity and sedentary lifestyle are leading causes of diabetes. The problem is that people get overweight because they get more energy-rich food than their body needs in respect to their physical activity, which means their blood sugar level gets high a lot more, which leads to insulin knocking on the doors of the cells and begging them to take even more sugar in. At some point, cells get tired of it and they respond lazier to insulin, which means that in bloodstream, there is even more sugar.
Don't scatter those dresses there. Let me go and give you food.
Someone is talking there. Did you have a question?
I've muted them. We can move on. Thank you.
Great. Yes, so sedentary lifestyle, and obesity are very important in the pathogenesis of this disease. Then environment. I hope there are some policymakers or policymakers to be are listening this presentation as well, because this is something to take into consideration. It is very important. Can people reach their health services in time? Are there good physical resources? Are there, for example, parks where to go for a walk or a jog? Is it safe to walk or cycle to work, for example? These are very important things. They do affect diabetes amounts. family history, we know that the lifetime risk of developing type 2 diabetes is 40% for people who have one parent with type 2 diabetes. And if both of parents have it, and I'm talking, of course, about, well, sorry, if both parents have it, then it is 70% to get type 2 diabetes throughout lifetime. But studies have shown that it is not necessarily that diabetes that is being inherited through genes, but obesity, that one we know that is inherited through genes. Eating and exercise habits, they go in family. And also we need to understand that a lot is unknown. For example, type 1 diabetes, we don't know much about it. And many studies are being done now. Why should we diagnose and treat diabetes in time? What does it do? High blood sugar levels irritate the inner lining. I will show you here with my mouse, inner lining of the blood vessels, both arteries and veins, and that makes it to change these lines. As I hope you can see that there is difference between this normal artery and artery with inflammation. They are different, and when they change, what changes also that how much oxygen and nutrients can these arteries bring to our muscles, to our organs. This doesn't happen overnight. It happens through a very long period of time, and diabetes is not the only disease that makes it. Obesity itself also makes chronic inflammation. But if you have it for a long time, then come these consequences. And the consequences are these. People who have diabetes, they get more stroke. Their vision gets blurry. At one point, diabetes was the major cause of blindness around the world. That is why in Finland, people who get diabetes, their eyes are screened every 3 years for free, so that we could get the changes in the eyes in time and treat them. In the mouth, infections come much easier. People get heart attacks, people get heart failures and kidney failures because of diabetes. Many cancers, liver cancer, pancreatic cancer, and colon cancer are associated with diabetes. Men get problems with erection. Women get a lot of vaginal infections. High blood sugar does not irritate only our blood vessels, but also nerves, and same changes happen in nerves. And because of that, people get either feet that are numb, they do not feel, for example, if you poke them with a needle, they do not feel it, or they get tingling feeling throughout the feet. It starts from toes and goes up. People who have diabetes for a long time, their wounds do not get better. We have had so many cases that a person comes to healthcare center, or actually in worst cases directly to the emergency room with a very bad wound, huge infection, and we even sometimes have to, unfortunately, cut part of the leg. And the person didn't know that they had diabetes. Their first sign with which they present to us is that awful wound. That was most of these, most of these adverse effects are linked to type 2 diabetes. With type 1 diabetes, why we should diagnose and treat it in time? Because the person can die if not treated. Gestational diabetes, that is diabetes during pregnancy, if we do not treat it, it has health risks both for the baby and mother. We will talk about it a little bit later. Signs of diabetes. One moment. Signs of diabetes, they are all linked to what I just talked before. the first signs that most people have are need to urinate often and always thirsty. It is due to high glucose sugar levels. The rest of these symptoms come a little bit later. No more tingling hands or feet, wounds that won't heal, and so on. Some people, unfortunately, do not feel these, or do not register that these are not healthy things. That if they, I don't know, are always thirsty, they should go and check their blood sugar levels. Type 1 diabetes, as I told, is insulin-dependent diabetes, and it is diagnosed usually during childhood or adolescence, but some people get it when they are adults. It usually starts abruptly, and classical presentation is that parents bring the child because the child started to be thirsty all the time, and it developed within several days, less than a week. It also might come with a stomach ache, nausea, and vomiting as well. In this case, blood sugar is usually very high, and these blood sugar meters, they might show high. So instead of a number, and I have seen it in a child, it will just show the word high. A higher number of patients are found in Finland and Northern Europe than in any other countries around the world. Here on the lower picture, you can see a person who has a blood sugar meter here on the other side of the belly. And on the other side of the belly is an insulin pump. It pumps steadily throughout the day and night insulin as much as needed. Before the insulin was discovered, it was a little disease. People were dying of it. But today, type 1 diabetes patients live a full life as long as they take care of it. And even Sharon Stone has it. And as we know, she does live a full life. Type 2 diabetes. It is usually seen in adults, but the child obesity epidemic that we see today throughout the world causes the disease even in under the age of 20 years. And this type 2 diabetes may be asymptomatic even for years. So if in type 1 it was within a week, here it is for several years, it can be without any symptoms. Numbers are staggering. They are very high. In Finland, right now, about 380,000 people had type 2 diagnosis in 2022. And research show that 20% of people with this disease are yet to be diagnosed, which means that in Finland are a little bit less than 500,000 people with type 2 diabetes. It is a huge number. What does it mean? Is it 10%? Yes, it's about, I guess, 10% of people having it. The global prevalence of type 2 diabetes in adults was in 2021, 536.6 million. That is about 10% of whole population. And it is expected that there would be 783 million people, which is 12.2%, living with diabetes worldwide by 2045. It's a huge number of people who will potentially have stroke, heart diseases, kidney diseases, blindness, and so on. Risk factors, most of the risk factors we have talked about before. It's the obesity, sedentary lifestyle, unhealthy eating, family history, but also diabetes during pregnancy is very important risk factor. Diabetes during pregnancy. In 2018, 20.6% of pregnant women had abnormal sugar levels, and these numbers are from Finland, from the Finnish healthcare guidelines. And globally, 14% of pregnant women have abnormal sugar levels. It's a lot of women who are young, and that we know that later in life will have diabetes. Babies that are born to diabetic mothers are bigger, about 4.5 kilograms and higher, which means there's a higher risk of getting trauma during birth to mothers and babies. Babies might get also transient hypoglycemia, which means that for a period of time, short period of time, they will have low blood sugar level. That is potentially little. That might even kill, unfortunately, the babies. These babies get sugar drip for several days, not many. And then it usually gets better. And these women who have high blood sugar levels are at high risk of getting hypertension and preeclampsia. Preeclampsia is a syndrome where a high blood pressure and signs of organ failure, for example, signs of kidney failure, and it is a very dangerous situation if it continues, if it's not treated, if C-section is not being performed, the woman might potentially die. Both the mother and the baby have higher risk of getting diabetes later in life. So when we are asking a person of their own risk factors, for example, if the person is exercising enough, what are they eating, and so on, we also need to ask if their mother had diabetes when she was pregnant with this person. Mother's risk is much higher than babies to get diabetes, which is why in Finland it is advised to follow blood sugar levels every 1 to 2 years for the rest of life. And it is estimated that after about 50 years after the birth, after that pregnancy, half of the women get type 2 diabetes. That is a very high number. About half of these mothers get pregnancy diabetes also in their next pregnancy as well. So it is important to let your doctor or nurse or midwife to know that you had gestational diabetes in your previous pregnancies. Medication. The first medicine to treat diabetes was insulin, and many people who have worked to get the insulin and then to develop it got Nobel Prizes. There were many listed. And World Health Organization has listed insulin as one of essential medicines, which means that places that are providing healthcare, they need to have insulin in that unit. Type 1 diabetes patients, life depend on it. Type 2 diabetes patients are started less on insulin nowadays because we have very, very good oral medicines. Many of them have positive effects not only on blood sugar levels, but also on weight, heart, and kidney health. For example, there is one class of oral medication that when they started making research, they wanted to do the research for 2 years, but they saw that the effects are so good on kidney and heart health that they stopped the research. They couldn't not give the same medicine to the other people who didn't get this medicine. Many fascinating researches have been done, and many more are coming. And then there are these weight loss medicines. I'm sure some of you at least have heard about them. They are GLP-1 receptor.
Weight loss medicine.
I'm sorry? Okay, so weight loss medicines. They are these. If someone was talking, I couldn't understand it. Yes, so for example,
I was just emphasizing that everybody should mute. We will have a question and answer session after the presentation. Yes. So you should jot down their questions.
Yes.
So we have a.
Yes. And GLP-1 receptor agonist group For example, Ozempic, everyone in the world seems to know it, and there are many more. These are very good medications that affect positively on the weight and also on blood sugar levels. Although we know about these medicines, we got to know about these medicines only in recent years, but these molecules have been known to science for many years. I think it was since 70s. I think it was in 70s they had discovered that there is this hormone. How to prevent diabetes? Is it preventable? Type 1 diabetes is not preventable as far as we know right now. In some researches, it shows that some viruses are linked to it. For example, if a person gets a certain virus infection, and then it might have effect on the health of pancreas. And but we don't know how to do it right now. Type 2 diabetes and gestational diabetes, that is pregnancy diabetes, not preventable completely, but you can lower your risk. And first one is physical activity. Exercise, exercise, exercise. Finnish UKK Institute recommends that we do everyday physical activity, which is climbing stairs instead of using elevator, walking or biking instead of driving, and so on, and at least 2.5 hours of exercise that raises your pulse. But this 2 hours and 30 minutes you don't have to do in one go, but throughout the week. That is a minimum. And when you do that, it is researchers show that there are many positive effects on your health. And also eat your veggies. Latest Nordic nutrition recommendations recommend 500 to 800 grams of vegetables, fruits, berries, and nuts for adults per day in total, with emphasis on dietary fiber contribution. And weight control, of course, because obesity, as we talked before, does lead, unfortunately, to diabetes as well as many other diseases. It seems like I have galloped through my presentation, but take-home message: diabetes is a disease to take very seriously, and one can lower their risk to get it by being mindful about their habits. And if one gets it, you can manage it with lifestyle and medicine. That was it. Thank you very much for listening. I hope you got the information you wanted to.